Welcome to another episode of Responsible AI in Action. I'm your host, Charles Dimov, CMO of Kama AI, the leader in responsible AI technology. Today, I have with me Chris Wynder. Chris was on the program last year when he was with OpenText. So welcome back, Chris. Now, Since then, Chris has actually moved on to become the executive director of Western Research Parks, one of Canada's leading science technology centers. They are a catalyst for commercialization, the partnership development, and research for startup opportunities collaborating with the University of Western Ontario. So great to have you with us again, Chris. It is such an honor.
Oh, it's great to be here. I appreciate you having me back. I'm really looking forward to this.
Yeah, this is excellent, and I love your perspective from last time, and I'm sure you're going to be providing us with extra special perspectives now that you're kind of heading up the Western Research Parks as well. So before we start, Chris, can you tell us briefly what does Western Research Parks do?
Yeah, so Western Research Park is in the middle, like many companies in Canada, we're in the middle of change. So if you'd asked me this, my first day of working, what does the park do? We're largely a property management group. We have 250,000 square feet of laboratory space, office space, industrial manufacturing space in London, Ontario. What is needed now for startups and our existing clients, and as I've talked to about half or three quarters of our roughly 100 clients in the last 2 months, is more support on the programmatic piece, more support on how do they get more efficient. And Charles, we've talked about this. The value
Mhm.
prop of AI and responsible AI is largely one of efficiency, particularly for small companies. And I think what I can do to help is to give them some of that efficiency. So what does the park do now? We hope to foster innovation for our existing tenants and to help bring that into the community that we serve. London, Ontario, Southwest Ontario, Ontario, Canada, and writ large.
Yeah. Okay. Well, that's good. That's a nice introduction to, can I call it WRP?
Yes,
So Western
please.
Research Parks.
I've it's a lot of name.
There we go. Exactly. Good. So, Chris, in your work with, because you do work with some hospitals and you work in the research environment, you raised some important questions the last time we chatted about, sovereignty and edge AI technology, which was interesting. Now, that is, I mean, the sovereign AI basically being, keeping data on site and under your control, right? So now, how do you see this shaping AI adoption, specifically in healthcare and maybe the public sector? What are your thoughts there?
Yeah, it's been really interesting. And Charles, as we talked about before, a lot of it was theoretical last year. The really fun part for me now is I get to do the actual let's get it done. So it's moved from the theoretical to how would you actually do it? And that's one of the things that's been really interesting over the last couple months is
Hmm.
that what most hospitals are looking for, what most of our highly regulated clients are looking for. I don't need the whole AI. I don't need AIification of everything. I need it to bring efficiency, but I need it to bring efficiency in things that can't go all around the world. So I think what we're seeing is, you know, old school, for you and I, old school software implementation. We take a project where we know we can show value to the users. We're going to do it, and then we're going to use that to expand outwards. So some of the things that we're working with some of our clients on are more pilot style, where we say, here's a problem where we can take data that exists and use it with AI, but only if that AI is on our site or we know that the data never leaves our site. So that idea of responsibility and trust and governance is starting to be embedded in the pilot project phase now, rather than kind of, oh, we can do anything in a pilot and then we'll figure it out later. I think people are realizing now after a couple of years of kind of mild failure of and having really great results in a pilot that's not governed, and
Yeah.
realizing that all the changes they need to make it governed make it they lose all their efficiency. So I think you're starting to see that change in mindset where they know what AI can do for them at home. Now they need to see how it does it in the context of a governed, we have rules, we have guardrails we have to use. How do we do that? And so I think that's the big change. And I think that's one of the things that the great conversations I've had over the last month, and kind of
Mm.
to tease a little bit, one of the things that we're going to see from the parks in the next kind of 6 months
Mm.
is
Yeah.
kind of a SOP on how you should do it. We're taking a lot of advice and we're looking to work with companies like Comma and others to to define what does responsible sovereign AI mean in Canada right now.
That's an interesting perspective. And I do think that you're being very gracious with your perspective on saying that, maybe some of the pilot projects are not converting well, where I think I was reading some research from MIT from late last year that
Yeah.
kind of suggested that number might creep up to like 95% or something. So I don't know. Anyway, regardless, we know that we've got some challenges out there that we absolutely need to kind of go and address, which is important. All right, so let's jump back in here. So many of the AI projects, as you mentioned, they do start as pilots. And again, a lot of times those pilots look pretty promising. They provide some amazing results when they're small scale. The big problem is that many of these just don't scale well, right? So they don't really go beyond that small experiment phase. This is particularly true in complicated or complex environments like a hospital. I mean, my goodness, how many things are going on in hospitals? So, what's the biggest barrier that you see when an organization tries to move from a pilot to a real deployment?
I think it's on misunderstanding the users. So
Mm,
it's conceptually, I take a pilot and so let's take a hospital environment. I take a pilot for that involves my neurology department. Just throw an department out there. Well, which is one of the more complicated. So from an IT perspective, you're like, oh, if we can show value for neurology, which is really complicated, it's surgery, it's feedback, it's PT, it's OT, it's all these things, then obviously going the enterprise software piece, obviously we can show value for something less complicated where maybe like ortho, where it's a knee, but it's not the whole brain and five different, next steps. The problem is that it's not transferable. These departments are so different. The
mm,
logic of what fixed workflow for neurology won't fix workflow for ortho, just to keep with the same example. And neither of
mm,
them will fix the problems in admin, in patient transfer, and the other parts. You don't get any value for neurology because they're still stuck with all the busy work of sending a fax, which they still do, sending an email, confirming with the patient, confirming with the other
yeah,
doctor, and then
yeah.
having no one contact the pharmacy. So if you don't do all those things, which require significant level of governance, and you
Mm,
don't have like the pilots aren't being done correctly a lot of times in highly regulated. They're
mm,
being done for a department because that's what you would do in manufacturing. You say, well, I'm going to take HR, I'm going to make it work for HR, and then they're going to be my champions for accounting because they work with accounting. And then we're going to have accounting and HR. And now we have most of operations. And then we're going to take this. Complex environments don't work that way because nowadays the no department is an island, right? So we're
yes.
still using
Right,
the
right,
old
right.
school logic of a department is an island, and therefore a pilot that fixes a department can show value to other departments because the people work with each other. Now it's
Right.
more integrated. So that pilot has to actually be more of the process across the best pilot or best pilots for those of you out there that partner with Kama on installing this stuff. The best pilots are going to be cross department. They are also the
Mm,
hardest
mhm,
to design and manage.
mhm.
And because you have to have a person manage it. You can't just give AI a whole bunch of stuff and tell them, fix this. Because you can't
Yeah,
fix a
yeah,
human-based process without understanding what the humans actually do. It's old school.
yeah,
Like the problems are
yeah.
very old school. They're people problems. And AI can't fix people problems without understanding what the people do. And no person is going to tell you exactly what they do in their day because we've told everybody that AI can replace them.
Ah,
You've
yeah, so there's a bit of reservation there, I can see.
And
Definitely.
and
Yeah.
right now that's a real problem. You're seeing people touting layoffs. You're seeing people talk about
Yes.
why, oh, we reduced our staff by 50% because of AI. Well, what's the
Yeah.
chances that the next organization that any of these companies go into to fix them, you're going to get a lot of help from the people that you're about to lay off. Like the logic just isn't there. And that's, to me, that's
Yeah.
another part of the responsible part is
Yeah.
why are you doing this?
Yeah.
You know
Yeah.
your process is broken. The responsible way to fix it for a company is to fix the problem for the people, which is often the
Yeah.
process and the cut and paste. Very easy problems for AI to solve. But
Hmm.
no, they're not big and sexy. Like they don't give you that case study that you can go to, a big multinational and say, we can save you $12 million a year. Like
Hmm.
that, the pilots that you should be doing are not the pilots that are good case studies for marketing.
Hmm. That's interesting. And that is a really kind of fascinating perspective as well, that you're absolutely right. We are trying to fix human, I guess, process issues and sometimes trying to force fit a digital AI into that. And
Yeah.
I'm not saying that it's always bad, but again, it's a really interesting paradigm that you bring up. And that actually kind of makes me think that, there are the studies from just a couple of years ago, basically saying that, AI team on its own, human team on its own, AI plus human team tended to beat out both of the other two teams. And maybe that's kind of, I think that's kind of more the philosophy of what responsible AI systems kind of take to
Yeah.
say it's not here to replace you. It's actually here to augment you and to make you better. And that means really taking a look at the workflows and kind of saying, okay, we got to troubleshoot this. And I love your perspective on saying it's not just one department. You've got to kind of make it so that it integrates amongst a series of departments. So that's brilliant. That's absolutely brilliant. So thank you for that piece. So let's moving on. There's right now there is a lot of pressure out in the market on organizations, on enterprises, on adopting AI really quickly. And I mean, it's in the news all the time, right? It's like, oh my gosh, and everyone feels that, oh, we're behind if we don't have this, if we're not kind of, pushing the envelope here. So from your perspective, what does that actually mean to get started in AI now in a responsible and practical way? Well, let's put it that way.
So I can give you an example from the organization that I run, which is the
Yes.
property,
Yes.
the corp. So
Perfect.
I've disrupted it by taking it from being a property management corp, which it was in December, to now
Hmm.
being what we call internally an innovation district, which means that in addition to the property, we're going to give you programs that'll make your business better. We're going to give you places where you can learn how to be operationally better and you can make better products, right? You can
Hmm.
innovate here. That's very different. And I have a small staff. There's five of us. For 250
Hmm.
square feet, we have close to
250 square thousand feet.
100,000 feet. Sorry.
Okay, yes.
I try and reduce the square footage every once in a while so I can wrap my head around how much there is to do. So I took the first month, I took over a process, I took over several processes, realized what we were not doing well. Not because the people weren't good, not because they hadn't been thought out, but because you just don't have the number of people that you need to manage this size of facility. Even
Mhm.
with Western South and University of Western Ontario has been great. They're very helpful. They provide us services at very reduced costs when they don't really have to. We still have to manage that. And so one of the things that I did is I looked at how are we managing this and what have I seen AI do well before?
Mhm. Mhm.
And so over the last and we actually were doing our QA, we started today. I used AI and I vibe coded a couple applications,
Mhm.
and we're now live
Mhm.
QA testing the processes to identify where AI can replace what the person is doing in that process. So we've identified six processes that we have to get better at to keep our operational costs in line with what we need to do and keep our team size the same. So it's not about getting rid of anybody. And I've been very clear
Yep.
and transparent. This is not about
Yep.
replacing you. This is about giving you back time so that you can do these other five things that I've already warned you we're
Mhm.
going to do over the
Mhm.
next two
Mhm.
years. So,
Mhm.
a lot of it came down to the project and change management piece. And so I have, not surprisingly, full buy-in, but they've been part of the process. And so that
Yeah.
responsible piece is saying, I'm here to help, right? The AI is going
Right.
to help you do your job. And I'm going to give you the opportunity to feedback on how it helps you. Because these are people, because I want my team to be successful as people, I've asked them to help me identify what sucks about your job. Like, what do you
Mhm.
want not want to do?
Mhm.
your role is still going to be the same in the organization, but what do you not want to do? Because probably AI can do it. And that's where we started. And we're starting to see, we're in the midst of rebuilding our website. We should have that done by the end of the month, where, I was anticipating it would take us 4 or 5 months, and we should by the end of the year, we've kind of identified if we can change these 6 processes, we will have reduced our operational yearly overhead by about 40%.
Wow. Wow. That's fantastic. That's spectacular. Okay. That's I love what you were just telling me about that stuff. So, in other words, you're taking a very tight team and you're just trying to make it, more manageable and
Yeah,
make them as effective as possible. And
10%
that
better.
is totally,
Yeah,
yeah, yeah,
that's
that
the
is
idea.
totally the right approach. Completely the right approach. I love that. That's a brilliant kind of example of using AI in the right direction. And so kind of to piggyback on that, so you're using AI to drive operational efficiency at
Yeah.
WRP. That's great. Now, sometimes that means using small focused applications that you kind of mentioned because you were doing some vibe coding and stuff. In your view, how can an organization balance the quick, efficient gains that they're kind of looking for with still with bringing in governance and control? Because again, if you think of the hospital setting, you can't do stuff without governance, right? It's you don't want to breach privacy or send somebody's okay, granted they're still using faxes, but still, you get the point, right?
Yeah. So I think one of the things, so I'll give you an actual real example. So we
Yeah.
work with a couple of hospitals in the region, and kind of one of the projects that I had kind of in my back pocket and was thinking about, and we talked a little bit about it. I didn't go into much detail, but I can go into more detail now. It's this concept of sovereign healthcare AI, and that
Yes.
is defined in my book, and this worked with the hospital IT team that I'm currently working with, as on-site, focused, and doesn't share outside. So
Mhm.
any AI source that you can use, anything like that, can be used for what we want to do. And so what we've defined is working within those guardrails. We've defined a set of processes that can use dedupe data and anonymize data. So we can take a dev sandbox, which will have 90% real data, but it won't have the
Mhm.
patient name. So we can do
Mhm.
analysis of the actual data. We can show it to the clinical researcher who's asking for it, or we can show it to the MD who's asking for it and say, would this help you? If this was patient Mary Brown, would this help
Yeah.
you? And so
Yeah.
with those guardrails, we've actually been able to start to build out a coalition of AI and data companies and hardware companies who want to be part of it and kind of help us define this, because the goal, you know, Charles, you and I live in Canada. Right now, Canada and its healthcare and the other parts, very important that we start to get right and get more efficient at. But it's uniquely Canadian. It's not a US solution is not going to work. A European
Mhm.
solution is not going to work,
Mhm.
but it also can't be built from the ground up. There's existing processes. You're not ripping and replacing every EMR and other software in hospitals. So we have to figure out what the edge is that can be fixed without ripping and replacing everything.
Hmm.
How do you find the puzzle piece that's missing that the AI that you're bringing in fits into that slot? Rather than saying, I have a AI puzzle piece, build the rest of your organization around it. We're saying, where's that? You have a gap. What does it look
Yeah.
like? We're going to build an
Yeah.
AI puzzle piece that fits into that gap. And that
Mhm.
approach
Mhm.
has really worked. And we're looking at kind of starting that pilot, and stay tuned, starting that
Mhm.
pilot probably in the fall. We're kind of still working to identify roles and responsibilities for the IT team there, the IT team here. And it's kind of morphed into some other things for some of our small startups where they're like, how can we get some advances out of this? So we're working on kind of building out a service model where they can
Yeah.
do a test of different types of AI that we've kind of, as a park, have kind of tested ourselves and say
Mhm.
these kind of AI work for a sovereign piece. These
Mhm.
might have a lower cost point, but and you can use them for operational gains. So I think we're at the kind of point where AI needs to kind of grow up from everything for every industry to, healthcare AI, you know, operational AI. We need to start getting to that point where it's matured to where it can provide point value within an industry and within certain areas. That's where
Yeah.
that's when we're going to start to see value. And it's even more important in Canada where we already have the scale of width of geography. You're never going to get all
Right.
these people in the same area.
Right. Right. Yeah, that's an interesting perspective. I mean, to have more AI which is specialized. So in other words, AI agents are specialized. At the end of the day, we don't expect a person to just be completely, you can't just pop in a person into any role and expect that they're going to do well.
Exactly.
We have engineers and we have scientists and we have, medical professionals and we have technicians and, all
Yep.
kinds of things. And excellent. So that interesting perspective. So last question for you. Recently, I was reading a report from Gartner, and they mentioned some pretty astounding stuff, actually. So they were talking about the enterprise space, and they
Yep.
mentioned that as many as 150,000 AI agents are going to be running in organizations by 2028, which is anyway, that's a lot. So, and that's only 2 years away, which is again the next astounding thing. So, in your work at Western Research Park, you see a lot of different startups and their work with AI systems, right? Now, what advice do you have for them as we face a prolific number of AI agents that are going to just be out there in the coming years? What do you think? What would you advise to these guys?
I'd have two pieces of advice.
Yeah.
The first one's on the operational piece, which is don't buy into the hype.
Excellent point.
If you are a 1 to 20 person startup, there's only so much AI you need to get stuff done. Don't lose sight of what your and I advise a couple companies on this. Don't lose sight of what your
Mhm.
goal is. If your goal
Mhm.
for the next year is to grow revenue by 20%, can
Mhm.
you use AI to do part of that? Yes.
Mhm. Mhm.
Should you obsess about having an agent that does your marketing and an agent that does your customer piece rather than using the 20 people that are probably generalists to do that? You're probably
Mhm.
better off training the person rather than mucking about with AI systems and all that stuff. It's not mature enough for just dropping it in. So
Yeah. Yeah.
don't buy it in light operationally. If
Yep.
you have any kind of web presence, if your product has any kind of software piece, you better
Mhm.
understand how AI can make it better. So you
Mhm.
need to either yourself or somebody in your team needs to not become an AI expert, but needs to become an AI learner, needs to be an
Mhm.
intellectually curious about AI. Even if it's
Mhm.
not part of their daily job, you need to have
Right.
somebody on your team. If you're more than two people, at least one person
Yeah.
has to be interested in AI and how it can be used.
Yeah. Yeah. Interesting. All right. Well, good sound advice. Wonderful. Chris, thank you again for coming onto the video cast and for this insightful discussion about what it really takes to kind of get that responsible AI systems out there into the real world. Your perspective on sovereign AI, that was pretty cool. And the challenges kind of moving from pilot to scale. Again, some cool advice on that side as well. And you brought a very practical lens for teams to navigate this AI adoption that we're going through right now. Because it's a challenging time. We're all trying to
Yep.
figure it out.
Yep.
So Chris Wynder is the executive director of Western Research Parks. There, he works at the intersection of research, commercialization, and innovation, connecting startups with the University of Western Ontario. And that wraps up another episode of Responsible AI in Action. In each conversation, we speak with leaders across the AI industry and those working on enterprise transformation to explore what's actually working. We look at what's working, what's not working, and how to deploy AI responsibly in the real world. Thank you again to all those watching. We look forward to seeing you on the next episode of Responsible AI in Action.